Hi guys, my name is Bhavishek and in today's video I'll discuss a new topic, that is the hyperacidity. Right guys? So let us begin with our first part, that is the introduction. And the first point is, it's a condition characterized by excess secretion of the acid, that is HCl, which means hydrochloric acid, from gastric gland in stomach. So guys, this very first point is very important. Okay, why? Because we get three new words. First is the acid, then the gastric gland, and then is the stomach. So I'll discuss this in brief. Right? First is the acid, that means the hydrochloric acid. So what you have to remember is that guys, this HCl, first of all, it is watery type, it is colorless, it is a digestive fluid, and it is acidic in nature. That means the pH value of this acid is 1, 2, 3. That is number one point. Number second, the secretion of the acid in the stomach is about 2 to 3 liters per day. Right? So guys, what is the purpose of this acid, that is HCl? So the main purpose is the breakdown of the food. That is number one. The second is that whatever the microorganism is coming with the ingested food, this acid kills them. That is number two. And one more thing guys, that this acid helps in the breakdown of the proteins. Not directly. What it does is, it activates an enzyme called as the pepsinogen. So let's write it down. This is the pepsinogen enzyme. Okay. And in presence of HCl, that is the HCl activates it to convert into pepsin. Okay. And guys, this pepsin helps to break down the proteins. Okay. That becomes the purpose of the acid. So now let us talk about the next word, that is the stomach. This is also important. So guys, here I have drawn a stomach, and you know that the stomach is present in the upper left quadrant of the abdomen. That means if there is my abdomen here, so if you divide into 4 quadrants, this becomes the upper left quadrant of the abdomen. That is the location of the stomach. Now let's label the parts of the stomach as well. Well, it's not of use in the pharmacology, but still I'll discuss to make a better understanding. So guys, this you know is the esophagus. Okay, cardia or cardiac, right? Then comes is the fundus. Then we have is the main, that is the body, and here we have is the pylorus part. This becomes the pylorus part. In pylorus we have two, that is the pylorus canal, and this becomes the pylorus antrum. This is very basic, that is the stomach parts, right? So guys, now my main concern is that if we examine this mucosa of the stomach, so we get that the lining of the stomach is basically a simple columnar epithelium cells. Simple columnar epithelium cells is the lining of the mucosa of the stomach. Okay, and there are 4 types of cells, that is 4 types of cells that makes up the gastric gland. Okay, so guys, what are those cells? So the first is the mucus cell, number 1. Then we have is the parietal cells, number 2. Then we have is the chief cells, and then we have is the endocrine cells, right? Mucus, parietal, chief, and endocrine. So guys, we have other names as well, so write it down. The mucus cell is also called as the goblet cells. The parietal is also called as the oxyntic. The chief is also called as the zymogenic, and the endo is also called as the, that is the G cells. So guys, the zymogenic chief, and it's also called as the peptic as well. So write it down. This becomes the peptic. Now guys, I want you to answer that out of these 4 cells, okay, which of the cell here produces this acid, that is HCl? So guys, the answer is the parietal cells. Why? Because the mucus cell secrete the mucus, parietal secretes HCl plus intrinsic factor, Okay, the chief and zymogenic cells. So guys, this produces the enzyme that is pepsinogen and lipase. So guys, pepsinogen, as I told you, helps in the breakdown of proteins, and lipase helps in breakdown of the fat, that is into fats and fatty acid and glycerol, right? And the endocrine cells, guys, here it secretes the hormone that is gastrin, which regulates the gastric activity. So guys, the next time if someone tells you that hyperacidity means there is an excess secretion of the acid in the gastric gland, that is in the stomach, so remember that it is this parietal and the oxyntic cells which is producing the excess amount of HCl here. Okay, that is all about the stomach. So guys, now one question more arises from this part is, so guys, three terms that I really come across in the gastric area, in the gastric topic. So let's write it down here. So guys, I can write it down here as well. So can you differentiate between the three terms, that is, first of all, gastric juice, okay, then is the gastric acid, and then is the gastrin. This is very similar terms, but all are different. How? So guys, gastric juice basically is the mixture of the secretions of, number one, that is the mucous cells, then is the parietal cells, then is the chief cells. These secretions together makes up the gastric juice. The gastric acid, guys, as you know, that is the HCl, is only produced by the parietal cells, that is the oxyntic cells as well. Okay, and the gastrin is an hormone which is produced by the endocrine cells. So guys, let's write it down. That is an endocrine cells is what release the gastrin, also called as a G cell. So guys, actually this gastric acid is a part of a gastric juice, but the gastrin, that is the hormone, is not a part of the gastric juice. Why? Because guys, this is an hormone. It is released directly into the bloodstream. Yes, it is released directly into the bloodstream, and it's not a part of the gastric juice, right? And if this is so, then we can also say that this gastric juice, that is the mucus, parietal and the chief, all these are exocrine, okay, released via the ducts. And if it's released in the bloodstream, that means this is nothing but the endocrine. So if we say it is a ductless, right? So gastrin is not a part of the gastric juice, but the gastric acid is a part of a gastric juice, right? This is all about a stomach and the gastric gland here as well. Next point is, it's also called as acid dyspepsia. So guys, dyspepsia, it means indigestion. So if there is an increased level of excessive acid, okay, this acid, then it will leads to indigestion, okay. And if that happens, then the following things can result. For example, first we have is the stomach discomfort. So guys, stomach discomfort, this means that there will be pain, there will be burning sensation in the lining of the mucosal of the stomach, right? So pain, burning, etc. Next we have is the flatulence. So guys, flatulence is basically the accumulation of the gas in the digestive system. If that happens, if the gas is accumulated, then it is passed from the body, it is expelled from the body via the anus, okay. So next we have is appetite loss. That means the person doesn't desire to eat any kind of food, okay. And at the last we have is the vomiting and constipation. So vomiting, you know, okay. And guys, constipation means that the person or the patient is having difficulty in emptying the stool. Why? Because the stool is hard and it is dry. That is the constipation, right? So guys, so I'll talk about all these drugs in detail in the next part, but for now let's complete this whole classification chart, because in the question answers, that first is the introduction part, then we'll write 3 points, and the next we'll do is the classification part, okay. In classification, guys, first we have is the reduction of the gastric acid, that is the HCl, okay. So how we'll do that? The first classification in this reduction of gastric acid is the H2 antihistamine. Okay, and let's cite the examples of this as well. So the first example is a very famous and a very common ranitidine, okay, cimetidine, and then we have is the famotidine. These are the H2 antihistamine, right? In proton pump inhibitors, so guys, I talked about this in my previous video of routes of drug administration in the systemic enteral route. If you can check it out, I talked about the pantoprazole in the oral route of drug administration. So in that I mentioned three drugs, that is the proton pump inhibitors. The first is the pantoprazole, right? Then we have is the omeprazole, and then we have is the rabiprazole. And I did told you that the rabiprazole is more efficient than pantoprazole and omeprazole. Yes, rabiprazole. Okay. In the anticholinergic, guys, we have the drugs that are the tilenzapine, pirenzapine, and propanthyline. So three examples is sufficient to write it down. Okay. In the prostaglandin, we have what we call as the misoprostol. Okay. Now this is the H2 antihistamines and the prostaglandin, everything is done. So next we have is the ulcer protective. So guys, in this we have the drug called as sucralfate and CBS. So guys, CBS here stands for, let's write it down here. So CBS stands for colloidal bismuth subcitrate. This is the CBS used in the ulcer protective. So guys, what is ulcer here? So ulcer means a break in the surface tissue. That is a break in the mucosa of an organ. You can say, for example, in the gastric, I would say that if there is a break in this lining, so that will cause an ulcer. Okay. Then we have as ulcer healing drug. So in this we use carbinoloxone. Okay. Next we have is an antacid, that is to neutralize the amount of excessive acid. We use systemic, that is the drug here in systemic is dissolved in the blood. Okay. In non-systemic, it doesn't involve the blood. So in systemic we have is the sodium carbonate, so NaHCO3. Okay, and next we have is the calcium carbonate, so this becomes a CaCO3. This is the antacids. Next we have is then anti-H pylori. So guys, H here stands for an bacteria that is called as Helicobacter. So this bacteria basically infects the stomach and cause variety of disorders. So to treat this kind of problems, we use 4 commonly drugs. The first is tetracycline. Then we have is the amoxicillin. Okay. Then we have is the tinidazole. At last we use metronidazole. So guys, the brand name of this drug is also called as in Flagyl. This is commonly used in the market. Okay, so this is all about the drugs of the hyperacidity, right? So if a question comes, start with the introduction, write the 3 points, then go for the classification, and you have to make this whole flow chart. Okay, and after that, in short, we'll discuss this whole H2 antihistamine, proton pump inhibitors, anticholinergic, prostaglandin, ulcer protective, antacid, and the anti-H pylori. So let us now move on to the next topic, that is the H2 antihistamine.